Good morning. Morning, everyone. My name is Danielle Clemens. I'm with the New Jersey Department of Health, Youth Camp Safety, and Public Rec Bathing Projects. I am pleased to welcome you to our Summer Responsibilities 2025 Best Practices for Local Health Officials meeting. Going to give time for others to join into the meeting. Again, I just want to reiterate this course or this session is for local health officials. If you are not a local health official, I kindly ask that you remove yourself from the meeting because this meeting is not meant for you. We are offering a camp operator meeting on May 7th, and that meeting will be more geared towards folks, camp operators, um, who want information on the youth camp safety rule. Just going to give it a minute more or so, just to allow folks to get settled in and prepare for the material. Good morning. Again, my name is Danielle Clemens. I'm with the New Jersey Department of Health Youth Camp Safety Project. I want to thank you for attending the 2025 Ready for Summer Key Responsibilities and Best Practices for Local Health Officials. Again, this meeting is geared towards our local health officials. If you are a camp operator, this meeting is not for you. We are offering a camp operator training on May 7th that will go over the youth camp safety standards. That being said, let's see. Again, I want to welcome you. We're glad that you decided to join us this morning to prepare for the upcoming season and review key responsibilities for youth camps, recreational bathing, and other health material. Before we begin, just a few housekeeping items. Please ensure that your lines are muted to avoid any background noise during the presentations. To submit questions, please use the Q&A section located at the bottom of your screen, actually at the top of your screen. Our speakers will respond in the chat throughout the session. For any questions we are unable to address during the webinar, we will prepare a FAQ document and share with all attendees afterwards. Please note that this session is being recorded. This training is intended solely for local health enforcement officials. If you are not a member of that group, we kindly ask that you exit the session at this time. There will be a camp operator training offered on May 7th that will provide key guidance for those trying to understand the youth camp safety standards in JAC 8:25. We are pleased to offer 2.5 continuing education credits for this webinar. To receive the credits, you must attend the live session and you must complete the webinar evaluation, which will be distributed at the conclusion of today's program. If you are a local health official participating as a group, please have your health officer contact us at youth.camps@doh.nj.gov with the names and associated emails of the NJLMN accounts of individuals who attend your group meeting. This is so that we can ensure that the credits are issued appropriately. We have a full and informative agenda ahead, so thank you for your time and participation. So let's get started. Our first presenter today are with the New Jersey Communicable Disease Program. Barbara Brothers and her group with the School Health Program, who also develops the youth camp health guidance. They're here to talk about keeping youth camps healthy. So Barb.
Good morning.
Morning.
I'm just trying to share my screen. Give it a second. Can you see my screen, Danielle?
Yes, it's loading right now. Thank you so much.
All righty. Well, good morning, everybody. And thanks, Danielle, for letting us crash your party here today. Today, I'm joined by Nicole Lamb. Most of you know her as the regional EPI. She has been with the school team since last July. So Nicole is going to speak to you in a few minutes. And Michelle Beauvais is our vector-borne health educator. So we'll all be giving you a little piece of some information. So we basically just wanted to jump onto this meeting to remind you of some new and some updated resources that are available as the new camp season begins. The updated outbreak guidance for the camp setting was sent out through links late last spring prior to the previous camp season. So we will be sending it out again sometime in early June. We're just going to go through it and make sure all the links still work and things like that. But that'll be coming to you soon. We're also joining the upcoming meeting that Danielle mentioned for camp administrators. And for those folks, we'll be going into a bit more detail. We'll be reminding them about reporting, how and when they should be in communication with their local health departments, what might be expected of them during an outbreak, talking about line lists, as well as available resources. And as Danielle mentioned, you can drop your questions in the Q&A, and we'll be monitoring the chat, so we're going to hang out for a little bit. So today, I mainly wanted to highlight the updated outbreak guidance for the camp setting. It's new, it's improved, has a new section on outbreak prevention, which also includes detailed information on cleaning and disinfection, vector-borne disease prevention, including resources and activities that are included in the guidance document itself that Michelle will talk about in a bit. There's also a section for residential camps. That's not new, but it has been updated in case you may be working with camps that have or sleepovers in your jurisdiction. So it's grown a bit. Sorry. This is our main outbreak camp guidance, so general guidelines for the prevention and control of outbreaks in camp settings. It walks you through, again, the steps of an outbreak investigation. That piece really has not changed. While probably overwhelming for a camp, it does give them an idea of what's expected of them in an outbreak situation, as well as giving them measures to prevent outbreaks of infectious disease in their camps. It does mimic our general school outbreak guidance, which I'm sure you're all familiar with. That was updated last year as well. And it does have a dynamic table of contents, so you can go directly to that section. So it has grown, but I think it's improved, and I hope it's helpful to you. This is the exclusion list. I'm sure you're all familiar with this. It's included in the guidance as well as being a standalone resource listed on the school health page. It's updated regularly, so check the website to make sure that you and your camps have the most updated version. In addition to the outbreak guidance, we've also recently updated our norovirus guidance. Again, this one is a bit larger than the previous document, but we did add information that we pulled from the main outbreak document. Hopefully there's less back and forth when you're going through multiple documents when you're working on norovirus outbreaks in your camp. So we did pull that cleaning and disinfection piece and all of those details. So again, this one grew as well, but I think we've improved it. So hopefully, again, that's helpful to you as well. CDC also has a camp-specific norovirus page, which has great information. It's available in English and Spanish. The link is noted here on the excuse me, on the slide, and we can drop that into the chat for you as well. It outlines prevention for camp staff, for parents, for kids before and during camp, some norovirus basics, going over food safety, and what camps should do when they have sick campers and staff. And in addition to the camp norovirus page, CDC does have other school-related pages with information that may also be applicable to your camps. So there are those. We can drop those in the chat as well. And then our school health page, where all of our school and camp related guidance and resources live. I have circled here a new classroom cleaning document that we posted a while back for teachers, kind of going over, what should be brought into class, cleaning wipes. That's how it started, with a question on can we bring wipes into the classroom, and then I worked with our folks upstairs in environmental health, and they came up with this great flyer for classrooms. But if this is applicable to your camp, you can share that as well. We also have the new vector-borne flyers that I mentioned that are within the guidance document. Here they are as a standalone. So with that, I will toss it over to Michelle, our vector-borne disease health educator, to talk more about vector-borne illness prevention. Michelle?
Thank you. Good morning, everyone. Yes, so I'm here to talk a little bit very briefly about the vector-borne education piece of all of this. So there has been some resources created which basically explain the importance of protecting yourself and campers from mosquito bites and tick bites at camp. So far 3 items have been created, and I'll give you a little preview in the upcoming slides, but there is room for more, which I'll also get to. The current resources consist of a flyer aimed at camp counselors, workers, and campgoers. Let me just... Oh, okay, there we go. Sorry about that. At camp counselors, workers, and campgoers. The second one is aimed at parents specifically and guardians sending their children to camp and things they could do to prepare them, but also afterwards what they can do. And then an activity sheet for younger campers for educational purposes to do on a rainy day or something like that. So I'll quickly walk you through the materials. So on the left-hand side, you could see the very brief just summary on how to stay safe from vector-borne diseases at summer camp. This is good for camp workers and camp goers. Then the right-hand side, you can see the parent flyer. And once again, I mentioned it tells you what to do before camp and after camp just to look after your children. So we really encourage these to be shared, especially with parents preparing their kids for camp, as we know that's extremely common during the summer months and summer break. And lastly, we have a summer camp activity sheet. This is, of course, as you can see, it's geared towards younger campers, but there's always room for more additional sheets and improvements. It could serve as a rainy day activity for young campers, educate campers on EPA registered insect repellent, educate campers on how to limit exposure to mosquitoes, and teach campers that both mosquitoes and ticks are a risk at camp and how to limit the bites overall. And this part is definitely newer. So I also did create an evaluation for the materials that you just saw. And we really would appreciate if you could share this with anyone you know who may end up using the materials, just to see once again how they could be improved. It'll also ask if there's any additional materials you'd like to see created. We know rainy day materials are often something that could be very useful for campers. So we're happy to create more things where there is a gap and if there's a need for that. And we really just want to bolster that education between mosquito and tick-borne diseases on those summer months. So this is a very brief Microsoft Forms, and it's just to provide feedback if you or someone you shared with have used these materials. That's all. And these will be found once again within the guidance. And now I'm going to turn it over to Nicole to continue.
Thank you so much, Michelle. We just wanted to briefly touch base upon measles. We know that it is the hot topic recently and that it's been in the news, and there's been a lot of questions from schools regarding measles. And just thinking forward, right now we don't currently have specific camp guidance for measles, but we do have a great page and a great resource, Measles Preventing the Spread in Childcare and School Settings, which is very much applicable to camp. Similarly to schools, camps are required to have immunization status of all enrolled campers or students and have documented proof of immunity or exemption to measles. We do encourage camps that encourage their staff to confirm that they have documented proof of immunity to measles and that the camp should be prepared to quickly identify and provide a list of children and staff without documented evidence of immunity to measles in the event of an exposure. In this guidance document, we encourage the schools and camps to establish a relationship with their local health department that can work with them with any concerns regarding measles. And then, sorry, I'm waiting for the next slide. We do have additional measles resources. We have a measles webpage that is updated regularly, including about exposures and the alerts. So if there are questions or concerns about potential exposures, we do post those on our webpage as well as sending out for you at the local health department links messages, but that is easy to find on our measles webpage. And then we also have another really helpful document that we have used in numerous settings, whether it's individual exposures or exposures identified for particular individuals, and it's entitled Expose the Measles. And this is a great FAQ document regarding potential measles exposures. And I can drop the link into both our measles page and the which links to those guidance documents. So you guys can be prepared if any questions do come in regarding measles in camps. And that is all I have for today. This is our contact information. You can email us at cdsschoolhealth@doh.nj.gov, and our phone number is available there if any questions do come up or any particular communicable disease concerns do arise. Thank you so much for having us today, and Danielle, I'll turn it back over to you.
Awesome. Thank you guys so much for the presentation. Lots of helpful information. It's unfortunate that it looks like I can't post documents in the chat. That's unfortunate, but what I can do is email participants with the literature that we covered during the presentation. So, all right, moving on. Thanks so much, school team. Next up, we have Darby McDermott, who is with the NJDOH Office of Veterinary Public Health, here to talk about H5N1. Darby?
Hi, good morning, everyone. Just wanted to make sure you can see my slides over here.
Yes, we can.
Okay, perfect. Thank you for having me. I just wanted to spend a few minutes to talk about H5N1 and some considerations for public spaces. So just to, sorry, one second. My view has changed a little bit. Sorry, are you still seeing the title slide or the next background slide?
We can see the background slide.
Okay, perfect. Okay. So just to provide some background, again, H5N1 or highly pathogenic avian influenza is caused by an influenza virus that's widespread in wild birds. And unfortunately, it's been causing outbreaks in the United States since 2022. So the map on the right hand, you can see that there are every single state in the U.S. has been impacted by the virus, and so there have been detections in wild birds in every state. In addition to it affecting wild birds, there's been cases and outbreaks in domestic poultry since 2022, and then dairy cattle since 2024 in the United States. In New Jersey, and there has been detections in 2025. So across the United States, there really was an increase in wild bird detections. Particularly, on the East Coast, this past winter, there was an increase in those sick and dead wild birds. I'm sure many of your local health departments have, been aware of this and receiving calls or questions about it. So in New Jersey, we have had detections in wild birds, a few detections in domestic poultry, including backyard flocks and live bird markets, some cases in a cluster of domestic cats, and even a few cases in bears. So in addition to, the outbreaks that have occurred in poultry and dairy cattle, there have been a number of other mammalian species that have been impacted, across the U.S. in certain cases. So when looking at the human side of things, one of the kind of good news that I have is that there haven't been any additional human cases reported in the United States since February of this year. So there have been 70 confirmed cases in the US, mostly in individuals after they've had direct close contact with dairy cattle or domestic poultry that have been infected. In New Jersey, we have not had any human cases of H5N1. And in the US, there has not been any person-to-person spread of this virus. So overall, the public health risk is considered low. Again, people that are at higher risk of exposure would be individuals that have occupational or recreational exposures. So any people who are working with infected animals or their byproducts, backyard bird flock owners, and animal care workers that would be at increased risk of exposure to infected animals. And those individuals should be taking additional precautions to help protect themselves. But what I wanted to focus on today is some guidance on H5N1 in public spaces, again, particularly because there have been, it's in the environment, there have been sick and dead wild birds. Wanted to discuss, what local health departments should know. We did send out a links message. A lot of the information that I'm going to be covering was in that links message that was sent out in March. I'll also put that link in the chat. But so first off, again, in order to report sick or dead wild birds, those should be reported to the New Jersey Department of Environmental Protection, Division of Fish and Wildlife. They did recently create a wild bird disease reporting form. So I have that link on this slide. That's the preferred method to report. It allows any individuals to go in and put down information on what birds, how many birds that they're seeing, the location. If someone cannot use this form, they can also contact the DEP Division of Fish and Wildlife hotline at 1-877-WARN-DEP. And then on the local health side of things, there's one thing I wanted to mention is that for any local officials or municipal officials that are opting to dispose of bird carcasses, those individuals that are going to be in direct contact with, sick or dead birds should be following standards for PPE use, disinfection, disposal, and biosecurity. And you can consult with Division of Environmental Protection or Department of Environmental Protection for any questions or specific scenarios that are occurring. So again, persons that are actually working with infected birds should be following PPE recommendations. So those, the right-hand side, that photo shows the recommended PPE for those high-level exposures. So it includes head or hair cover, safety goggles, an N95 or other NIOSH-approved particulate respirator, coveralls, disposable gloves, and either boot covers or rubber boots. Addition to that, making sure that personnel are avoiding direct contact with those carcasses, considering the use of a tool, if moving any carcasses, washing hands and any exposed skin if there is any accidental contact, so making sure that's done with soap and water. And again, if workers are working with potentially infected animals, making sure that they're working with their occupational health and that they have knowledge and training in the PPE use. Additionally, for carcass disposal, again, any questions you can discuss with DEP as well, but making sure those, if they are being picked up, using double-bagged non-porous contractor bags and disposing at either an appropriate landfill or via incineration or in a secure trash bin that would be inaccessible to other animals. And then other items, including non-disposable PPE, should be cleaned and disinfected. On the public side of things, again, for potentially contaminated public areas, the general risk to the public remains low, and closure of a public space would not be recommended by Department of Health solely due to the detection of H5N1 in wild birds. However, depending on different scenarios, there may be other precautions that may be warranted. So again, if there is a die-off of dead birds, limiting access to areas with those dead birds or carcasses or areas that have had significant contamination. Some things that should be done, though, is, again, making sure that the public is aware and should be advised to avoid handling sick or dead wild birds, recommending that they not approach or touch the geese, ducks, other waterfowl, and making sure that people are aware that wild birds can carry germs, including the bird flu, even if they appear healthy. And again, there are a number of other germs that birds can carry, so always recommended to keep a safe distance from wildlife, including wild birds. For particularly contaminated surfaces, people should avoid touching, water or surfaces that are heavily contaminated by birds or droppings. And if they are in contact with that, making sure that they're washing their hands using good hand hygiene after any kind of potential contact. Again, avoiding touching the eyes, nose, or mouth when you're in and around potentially contaminated areas is also recommended. Signs can be used and should be considered to notify the public if there is a potential presence of H5N1 or HPAI in the area, the current risk to the public, and recommended precautions like we've been discussing about avoiding contact with sick and dead wild birds, hand hygiene, things like that. And hand hygiene, again, of course, is key for all types of, infection control and prevention of disease spread, including, H5N1. So making sure that people are advised to wash their hands thoroughly with soap and water, or if not available, using alcohol-based hand sanitizer. Cleaning and disinfecting footwear if you have been in an area that's potentially contaminated, and changing any clothes, potentially contaminated clothes prior to interacting with other animals or pets. And then if getting any questions about pets in public spaces, keeping dogs on a leash would be recommended. That would help to prevent them from going into contact with wild birds or other areas, keeping pets away from wild birds or heavily contaminated areas, and cats are recommended to be kept indoors. Cats have been found to be particularly susceptible to H5N1 and can have severe disease. So I just wanted to put my contact information up here. So if you have any questions, you can contact the Communicable Disease Service or me via email. And some resources. You can find additional information, the latest details on H5N1 on that H5N1 landing page. The links message that I mentioned, I'll drop it in the chat as well, but that can be found on our novel influenza page. And again, the good news, hopefully we'll continue to see a decrease, but overall activity has seemed to, of H5N1 has seemed to be decreasing, and hopefully throughout the summer we continue to see that decline. Thank you.
Thank you so much, Darby. Yes, we absolutely hope that we continue to see the decline, and but We have your information, and if you guys have any questions, please drop them in the Q&A. Thank you again, Darby, for the timely information. For any questions that we are unable to answer or address during this webinar, we will be preparing a FAQ document and sharing it with the attendees afterwards. All right, so let's move ahead to, I think next on the agenda, not that. On the agenda is public recreational bathing. So let's go to here. Public recreational bathing will be covered by myself. Again, my name is Danielle Clemens. I'm with the New Jersey Department of Health, Youth Camp Safety, and Public Recreational Bathing Projects, along with Dee Lee, who is the Environmental Scientist 3, who also participates with the recreational bathing and bottled water projects. So, can you guys see my screen?
Yes.
Perfect. Okay. I'm going to start off talking about the checklist for public recreational bathing facilities. Did you know that some pre-operational inspections can be completed without an on-site visit? Facilities are able to complete the checklist for public recreational bathing facilities and submit it to their local health officials. Again, you must get clearance from your health officer to accept this document in lieu of the on-site pre-operational inspection. Another caveat is this is for existing PRB facilities only. This would not be for a newly constructed PRB facility who are not eligible to use this form for their first inspection. Any newly constructed PRB facility must receive an on-site inspection before it is opening. Inspection frequency. For seasonal PRB facilities, they must be inspected at least once a year during the bathing season. For year-round PRB facilities, they're required to undergo a minimum of 2 inspections per calendar year. The local health department shall issue a written approval or disapproval of the facility within 10 business days following that inspection. You'll be able to find the meat of this text under pursuant NJAC 8:26-2.5. So the public recreational bathing rule, it was readopted without change in 2023. So currently the version that was adopted in 2023 without change is in effect. In the fall of 2025, this year, we'll be holding stakeholder meetings to review proposed changes to the PRB rule. We'll be providing more information with our local health departments as stakeholder sessions are scheduled. Roles at the recreational bathing facility. The trained pool operator. Sometimes folks call it the certified pool operator, which is a trademark term, which is why it is not in the rule. So the trained pool operator is responsible for the maintenance and mechanical operation of the pool. They must complete certified training, which is listed in the current certified trainers list we have online. They must visit the facility at least once per week to review records and inspect the pool. Documentation of that visit should be maintained on site. Another role is the designated adult supervisor. This person oversees the operation of the pool. They must be knowledgeable of the regulation. There is no certified training for the designated adult supervisor. They are responsible for ensuring that all the operational compliance is taken care of at the pool. Their name and contact number must be posted conspicuously at the pool or recreational bathing facility. Pool director is required only at pools that are 2,000 square feet and above. This is a certified training position. They must complete the training listed in the currently recognized certification list to oversee a pool as the pool director. Lifeguard staffing requirements for pools. For pools under 2,000 square feet, at least one certified lifeguard must be on duty. Lifeguard must be certified using the current recognized certification list, and they must operate in a zone of protection, making sure that they're overseeing the pool, using a scanning method to ensure that the zone of protection is being covered during their lifeguard duties. For pools that are greater than 2,000 square feet, there's requirement of 2 certified lifeguards. Again, these lifeguards are working in conjunction to cover the zone of protection, making sure that they're scanning the pool and ensuring that bathers are accounted for. Lifeguard staffing requirements for natural bathing waters. Ocean, bay, lake, river, bathing beaches, at least one lifeguard is required per 300 feet of designated bathing area. At least 2 lifeguards per 300 feet of designated bathing area is required whenever there's other beaches open. Those lifeguards must be on duty at all times when the beach is in operation. If a designated beach area is less than 100 feet, then only 1 lifeguard is required. There's 2 different types of lifeguard training for natural bathing waters. If we're talking about ocean and tidal waters, the lifeguard training is group-based and is site-specific training. They're trained in teams and not individually. So they're not individual lifeguards, they're a team of lifeguards. The training is conducted in accordance with the United States Lifeguard Association, which is the USLA standards. The beach operator, or the owner, secures a USLA aligned training agency to train all the staff for that specific beach. The certification, again, is site-specific and not transferable to a pool or lake environment. For lake and non-tidal water lifeguards, these lifeguards are similar to pool lifeguards, wherein they receive individual training. They complete the standard lifeguard certification course, which is listed in the approved recognized certification list. And these certifications are widely recognized, and these guards may work across the state at different pools or lakes. They can be hired and moved like traditional pool lifeguards. Important note, while some training components overlap for ocean, tidal, and lake pool lifeguard certifications, they are not interchangeable. They can be coupled for dual environment staff, but the lifeguard credentials must match the body of water they are guarding. Here's what the current recognized certification list looks like, and it's updated on our website. We review this list and update it annually and repost the list after revisions are made. Understanding specially exempt facilities. Defined terms in the regulation are specially exempt facility and common interest community. A facility must meet one or both of the definitions to qualify for the exemption. Facilities that meet the regulatory definitions do not need to apply for a specially exempt status. There is no application process for a firm to meet the specially exempt status. Facilities that maintain high risk appurtenances, example, a diving board or a water slide, still qualify for the exemption. In 2019, there was a statutory change wherein specially exempt facilities with high risk appurtenances were allowed to maintain their specially exempt status regardless if they had a high risk appurtenance. So, key reminder here, recreational bathing facilities cannot apply for the specially exempt status. They either meet the definition or they don't. The scope of specially exempt status. Specially exempt facilities are only exempt from the lifeguard requirements and the first aid personnel requirements. They must implement all other provisions of the rule. And under 8:26-5.1, they have additional requirements for postage and signing that they must comply with. That includes notifying the local health department of whether they plan to accept the designation of specially exempt. Automated monitoring devices. What's allowed? So facilities may use water quality monitoring devices that provide real-time readings. However, these devices that do not automatically administer chemicals when levels are out of range are only permitted at pools where trained staff are on duty to respond and adjust chemicals immediately if needed. So picture here is a device that reads pool pH sanitizer, water temperature, etc. At a specially exempt facility where there is no lifeguard placed, some specially exempt facilities do still place a lifeguard despite their not having or required to do so. So if a specially exempt facility who has a water guru or some other water monitoring device implemented at their pool, if they don't have someone on site at all times, then they cannot utilize this monitoring device. They would need a chemical feeder or a chemical control system. So what is the chemical control system? Chemical controller system, or chemical feeder, automatically adjusts pool chemical levels to maintain water quality. These systems are permitted under the regulation, but must meet specific installation and usage standards. You see here that 8:26-3.22, -4.8, -6.13, and 6.414 all talk about chemical controller systems and how they should be implemented, maintained, and used. So chemical controller systems must be installed according to the manufacturer's specifications. They must have backflow prevention devices. They require secure weather-resistant housing if they're placed outdoors. They're required to be installed downstream from the filter and the heater. They're required to be wired so that it cannot operate unless the filter pump is running. And they should be maintained, inspected, and calibrated routinely by facility owner, operator, or CPO. Testing requirements with chemical controllers. Manual testing of the water quality is still required to be done twice during the day, once at opening or once at closing, or however the organization takes manual readings of their water. to ensure that sanitizer levels are adequate, pH levels are within range, etc. Use a DPD or equivalent testing kit in order to test the quality of the water. The facility must document those results each day the pool is open. For the system data, it must have the capacity to download, store, and print the chemical readings. The data must be made available upon the request of the local health authority. Hot tub, spray park, and spa supervision requirements. At these facilities, designated adult supervisor must be assigned to oversee all phases of the spa hot tub operation. They must be knowledgeable about the regulations, and they're responsible for the daily operation, compliance, and safety of that facility. The certified first aid and CPR requirements, at least one person currently certified in standard first aid, and adult, child, and infant CPR, which is considered professional level, must be on site. The certification must be received from someone listed on the recognized certification list. If not stationed at the spa, a conspicuous sign must be posted indicating the location of the certified professional and the method of access, example, a phone number. Emergency shutoff switch requirements. So the emergency shutoff switch for pools and spas is required by the UCC construction code. Here we've indicated the actual provision that talks about the requirement. The purpose of the device is that they disconnect the power to the recirculation pumps, jet systems, and air blowers. Installation requirements must be accessible and viewable from the pool or spa, must be installed at least 5 feet away horizontally from inside the walls of the pool spa. Again, if you have questions on the requirement for the emergency shutoff switch, you would contact the construction official who has jurisdiction over or has a broader understanding of UCC rules. There's also a way to get in touch directly with UCC personnel. It's called Code Assist at dca.nj.gov. That's their email. They're very responsive. So if you have questions about any UCC codes, you want to reach out to Code Assist at dca.nj.gov. AED requirements for pools. So AEDs are only required for pools with lifeguards. If the pool has a lifeguard on duty, then the AED is required to be on site. AED must be readily accessible, properly maintained, and staff must be trained in its use as part of the lifeguard certification requirements. Showers. They are required. The PRB at the bather rules requires the bather to shower. So this applies to all aquatic venues, and it's essential to maintain water quality, reduce chemical demand on the pool water, and minimize health risks for all users. Restrooms are also required. All public recreational bathing facilities are required to provide access to the restroom facility. These facilities may be permanent or portable units. Units must be properly maintained and sanitary, and it applies to all PRB facilities, including pools, lakes, and beaches. VGB, Virginia Graham-Baker Act, is a federal law to comply with the Virginia Graham-Baker Pool and Spa Safety Act by ensuring that compliant pool, drain covers, and secondary anti-entrapment systems are installed to prevent serious injury or death of pool and spa users. We in New Jersey use the CB20 form to document replacement of compliant drain covers. Who completes the CB20 form? The form should be completed by the local health department with input from the CPO, our person in charge. However, if your jurisdiction has a system in place for collecting your CB20 forms, please utilize whatever system works best for your town or county. When completing the form, you want to make sure that information is completed as fully as possible, and the document is signed by the CPO or operator or owner. We were alerted about a couple of Consumer Product Safety Commission alerts. The MaxSmart pool drain cover has been recalled due to entrapment hazard. The product was sold on Amazon, and the notice for recall or for folks to check their pools came out in October of 2024. This particular drain cover is mainly used by residential pools. However, you may, if you come across it as being used in your public spaces, please definitely notify the owner operator to remove that drain and replace it with a compliant drain cover. The Consumer Product Safety Commission also released additional information in April of 2024 about how to review different types of drain covers, including etchings on the drain cover that helps you to identify compliant versus non-compliant drain covers. I'll share that information. We've sent it out via links in the past, but we will send it out again following the conclusion of this training. Medical abandonment wash-ups. It's a collaborative response guide. We work on it with our partners at the DEP, the state police, the DOH, and others. All participate in drafting this guidance document that originates from concerns about syringe wash-ups dating back to the 80s. It ensures safety for the public, but the purpose is to provide local health personnel with essential information on how to respond to beach wash-ups, when action is needed, and what specific steps to take when encountering foreign materials like syringes on beaches. The document was revised and should be released fairly soon. Once it is released, we'll be really sending it out via links for your awareness. Cold plunge. We've heard a lot about different health officials and offices receiving inquiries about cold plunge pools. So what would be considered a PRB is the first question. dump and fill units are not considered PRB facilities. Again, because the water is not recirculating, there's no need for cleaning that water because it can be dumped and refilled with fresh potable water. Those units would not be considered a PRB. Non-recirculated water, like those splash pad without recirculation, would not be considered a PRB. For cold plunge in natural environments, those activities must be conducted within waters approved for bathing so that the water is in conformance with microbiological standards identified pursuant to Chapter 7. At current, we're deliberating on how to handle these units and will follow up with additional guidance as soon as possible. So far, the conversation has been that these cold plunge units would be overseen as spas. The hot tub and spa section would be an appropriate place for these folks to be in line with the regulation. So we've had an organization, let's see, their name is Sweat House, that has reached out for guidance on operating within the state. They have a specific unit called the Cold Plunge Max that has been reviewed, and we're in constant communication with this organization to move forward with allowing them to operate. However, the final approvals have not yet been provided. Once that information or approvals have been given, we will forward that information to you guys at the local health level. At current, we await feedback from the organization based on questions that we had with the Cold Plunge Max, as well as some specific requirements for operation within different different areas. The waiver of standard is able to be applied for by any PRB facility in congruence with subsection 1.4, which is the waiver section. The organization has to request the waiver from the DOH, NJDOH PRB project. We're looking for them to follow the guidance of the provisions that they must explain, such as how this particular unit or whatever they're asking waiver from, how it protects public health, what is their, what are the constraints or hurdles that the organization is facing in order to be requesting the waiver of standard from the department, in addition to a couple of other questions that have to be answered within the waiver for them to request the waiver of standard. Another waiver of standard that we received recently was a waiver requesting exemption from maintaining emergency equipment at specially exempt lake facilities. That waiver was denied. It was issued by the New Jersey Coalition of Lake Associations. Lastly, the YMCA submitted a waiver in 2021 asking for a waiver of standard with placing 2 lifeguards at a lap pool when no other activities are happening in that lap pool. That waiver was approved. And if you need a copy of that waiver, you can write to us at njprb@doh.nj.gov. The YMCA organization should also have a copy of the waiver. Our organization is continuing to do our best to improve drowning prevention and drowning safety. So we have, over the last year and some time, been conducting a statewide PRB census. Again, the goal is to create a comprehensive list of all public recreational bathing facilities operating within the state. The benefits: improve public safety and drowning prevention. It helps us to track trends and public health impacts as it relates to bathing facilities within your jurisdictions. It also helps us in trying to address data-driven policy decisions and make informed decisions about the regulations and the public health initiatives to address disparities in access at our public recreational bathing facilities. So the census is extremely useful. We've had a number of local health officials and local health departments to fill out the bathing census, but we haven't had 100% of our local health officials and local health departments complete the survey. So we're asking if you can please complete the survey if your department has not already done so. For those of you who have already done so, thank you so much. Your information and your attention is appreciated. Okay, I'm going to pass it over to Dee. Dee, you ready?
Yep. Thank you, Danielle.
Absolutely.
Good morning, everyone. My name is Dee Lee, and I'm assisting Danielle with the Public Recreational Bathing Program. So I will start from here. Drowning. Drowning is the process of experiencing respiratory impairment from submersion or immersion in liquid, and it is not always fatal. So we have fatal drowning and non-fatal drowning. Fatal drowning is obvious. The death, death occurred due to the accident, and non-fatal drowning happens when a person survives the drowning incident, and it could have a range of outcomes from no injuries to very serious injuries such as brain damage or permanent disability. Next page, please. Next slide. Thank you. Fatal serious accident report form. So we've been collecting the CB2 fatal serious accident report form from our local health authorities during past. And the couple requirement is upon the notification of the death of serious injury, the local health authority must immediately investigate and complete the fatal and serious accident report form. All deaths, injuries to the head, neck, spinal cord, and any injury causing unconsciousness must be reported by PRB owner or operator to local health authorities within 24 hours. And local health department would need to communicate the incident to DOH at ngprb@doh.nj.gov within 24 hours of notification from the PRB owner or operator. Next. Who submit the form? Local health authority investigate the incident and complete the fatal serious accident report form. And we ask you to submit the form within 5 days of notification by the facility. However, if you you need to submit it to us within 5 days, but if you're not able to collect all the information, please submit another copy once you get as much as information as you could. Just submit us a new form so that we have a relatively complete form for data collection. How to submit? One is through email, njprb@doh.nj, sorry, njprb at doh.nj.gov, or you can submit through beach management systems. I believe a few local health department would start participating in this using the beach management system this year. And Sherry will show you a little bit more about this new platform later. Next slide. On the CB2 form, important submission notes, inspectors are encouraged to conduct a thorough investigation and follow-up activities to ensure the information is as complete and accurate as possible. Again, if you need additional time to complete all those informations, let us know. And you can always, after the first submission, within 5 days, you can always send us a new copy of the form. For each individual involved in an accident, we need one form. And complete all fields in the form. And there's one thing we want to emphasize here is the victim ID. The victim ID is, like, for example, you have multiple victims, you would put one of the number of total victims. So that's how you put that. Next slide. Want to show you some drowning stats. So this first figure is drowning cases by gender. The pinkish bar is represent female, and the dark blue purplish bar represent male. So you can say from the data we collected since 2018, it's quite obvious male drowning cases happen more in male than female. In 2021, there is a gray bar, that's the data unknown. That is a group of accident that we don't know the gender. And in 2022, the drowning cases in female is much higher, that because a group of 12 girls was involved in one accident. Next slide. On the left side is fatal and versus non-fatal cases. So we have more non-fatal cases compared to fatal cases. And on the right side, drowning cases by age group. You can see in New Jersey, in the past 6 years, we have more drowning cases in the age of 5 to 18 group. And when you see those bars, you see some red color and green color. So the red color represent the fatal cases. So you can say in age group 19 to 65, it seems fatal cases has like fatal cases are more than non-fatal cases. Next slide. On this last figure, we want to show you the importance of having a lifeguard. On the left side, it's showing when there's no lifeguard on duty. You can say the fatal cases is 73% versus non-fatal cases, that is 23%. Well, on the right side, when there's lifeguard on duty, you can say 81% is non-fatal cases. Well, only 14% is fatal cases. So it shows us the important role of lifeguards plays. So we're reference this. A lifeguard is like a storm shelter. You may never need it, but if you do, it can be a lifesaver. And you can tell that is true based on our data. Next slide. Because we had quite a bit drowning cases happened last year, so we are planning for water safety campaign, and we are hoping this can happen maybe in May before the season starts. There's still a draft, not approved for distribution yet. So our campaign, the same, is float, F, find a buddy, don't swim alone. Wear a life jacket. O, obey barrier rules. Do not pass the barrier that is not authorized. Adult is watching, so please, we want to make sure children's swims under the adult supervision and never be left unattended near water. Take swim lessons. Learn to swim is a life-saving skill. Drowning can happen in seconds. Again, wear a life jacket, adult supervision, take swimming classes, and we have the CDC link for your reference. Next slide. Life jackets. Life jackets has different categories. There's life jackets for infant, child, youth, and adult. We know arm floats, it's very common, but we would say it encourages an unnatural vertical position in the water. It can easily slip off, potentially leaving a child unable to stay afloat, and it does not provide support of the torso along the head to remain in the water. So wear the life jacket. Meanwhile, we want to also say that the best life jacket is the one you will wear. Some styles of life jacket are not intended for weak or non-swimmers. So read the label, and make sure the life jacket is worn properly. Next slide. Geomin form. So for the freshwater basin beaches, we collect geomin form 2 weeks before the season starts until the end of the season, around the beginning of mid of September. The standard for E. coli densities, it should not exceed 330 colony forming units per 100 milliliters, and the 30-day rolling geometric mean should not exceed 100 CFU per 100 milliliter. The geomean form should be transmitted electronically in the format specified by the department, to the department, and to the Department of Environmental Protection, and the department weekly at the end of the first 30-day period and weekly thereafter until the end of the season. Some of the department this year would also do this through the beach monitoring system. It's just the same as fatal accident report. Accident actions per NJSA 82676 requires lab to report to the state and local health authorities within 1 hour of result being obtained. Lab needs to provide written documentation to client and health authority within 1 day. Health authorities not participate in the CCMP, which means if it's not a coastal beach, it's for the freshwater beach, you would need to notify the department of an unsatisfactory microbiological sample result within 24 hours. And when accidents happened, additional sampling is required within 24 hours. When there's an accident, a sanitary survey needs to be done so that we can figure out the source of pollution. Post signs at all beach entrances and both ends of the beach within 1 hour of the first accident's notice and within 1 hour of the second accident's notice. Next.
Okay, I think this is meaty. Thanks so much, Dee. I'm taking it over from this book. So the completed CB2 forms, which is the fatal serious accident report, and the geomean forms can be submitted one of 2 ways. Either email to njprb@doh.nj.gov, as Dee communicated, or using the beach management system. The beach management system is something new. We've been talking about it for many years, I think since 2019, but it is finally up and running, and we have about 17 local health authorities, including state parks, that should be using this beach management system starting this year for their geomean, freshwater geomean documentation, and potentially for the Fatal Series Accident Report form. So the beach management system, back in I think it was 18, Governor Murphy pledged more than $13 million in funding to address HABs, to enhance the department's ability to address HABs statewide, to reduce non-point source pollution, to build the state's infrastructure to increase monitoring, testing, and data management, and to increase communication between the DOH, DEP, and local health authorities. Benefits to using the BMS is that there are role-based access, is real-time data that is shared between local health, DOH, and DEP, and there are approval workflows wherein if you are at the local health official, you can have your beach operator participate in the BMS, enter their data for exceedances, whatever their lab results are. They can enter it into the BMS, and you as the local health official can approve it, which sends it up the chain to DOH and DEP. The forms that are included in the BMS are the 30-day rolling geomean forms and the Fatal Series Accident Report forms. Public-facing tools are also available, wherein Sherry will go more over what this looks like, wherein the public can see which beaches are operating or open if it is a public beach. You can also restrict information for beaches that are quote unquote private. So full adoption of the BMS by local health authorities is expected within 5 years. We're transitioning transitioning to a paperless system for the geomean forms and the Fatal Series Accident Report forms. Initial launch of this BMS system will start this summer with 37 public recreational bathing facilities. And again, expected full adoption by local health departments within 5 years. The future, we hope that it enhances our data sharing capacity. It increases communication and better response time for water quality and management across the state. With that, I'll bring on Sherry. Sherry, you ready? Now stop sharing my screen. And Sherry's with the DEP to talk about the beach management system and other CCMP information.
Yes, thank you, Danielle. So I'm Sherry Schiffer, and I'm an environmental scientist with the New Jersey Department of Environmental Protection, and I am the program manager of New Jersey's beach monitoring program. I'm going to briefly tell you about our program and our new beach monitoring system that Danielle and Dee were mentioning, and then how to report pollution incidents and conduct sanitary surveys. So although at DEP we administer the beach monitoring program, we leverage resources. We couldn't do it alone. And we have several partners. The Department of Health is responsible for the regulations surrounding the program. The local health authorities are out in the field grabbing water samples and conducting the sanitary surveys, as well as communicating with the beach owner and operators. And then we also partner with the New Jersey's Forest Fire Service for aerial surveillance during beach season. So at all public recreational bathing beaches, we assess the water quality by monitoring weekly and analyzing the samples for fecal indicator bacteria. And that indicator bacteria in marine water is Enterococci, and for freshwater, it's E. coli. And the fecal indicator bacteria itself is not generally harmful, but it indicates the possible presence of pathogenic bacteria, viruses, and protozoans that also live in human and animal digestive systems. So therefore, swimming in water exceeding the standard poses an increased risk of illness such as gastroenteritis, low-grade fevers, and infections. The next part of our program is public notification. If there's an exceedance of the standard, a beach action is posted online at our website and posted on the beach entrances. The first exceedance requires an advisory to be posted at the beach. A beach is still open for swimming during an advisory, but alerts the public of the exceedance to weigh the risk on their own. And we recommend that the elderly, the very young, and immunocompromised individuals do not enter the water during a swimming advisory. In addition, resamples of the station that exceeded the standard are required in sanitary surveys. And I'll go into the sanitary surveys in a little bit. If the sanitary survey reveals potential pollutants impacting the water, the beach can be closed for swimming or will be closed for swimming. And if a resample exceeds the standard, the beach is also closed for swimming. Closures will then be posted online and at the beach, just like the swimming advisory. And this will continue until resamples are back within the standard and the sanitary survey reveals it's safe for swimming. Then that beach can reopen for swimming. The last aspect of the recreational beach monitoring program is responding to pollution incidents. If you or the public is aware of a pollution incident, it should be called into our hotline or reported through our app. This ensures the proper programs are notified. For the beach monitoring program, we will receive reports on all incidents that are within tidal waters to coordinate a response to ensure public health and safety at swimming beaches. This includes holidays, weekends, and after hours. These incidents may range from trash wash-ups, fish kills, algal blooms, and pollution events that can either be like oil or hazardous waste spills, sewage overflows, wastewater treatment plant failures, etc. Pollution incidents may require a beach to be closed as a precaution while investigating the water quality impact, and it may or may not require additional monitoring. So now I'm going to briefly demo our new beach system, as Danielle was mentioning. It's been in the work for several years. We contract with Rutgers to produce the website, and I'm going to first go into, hopefully this will go onto my web. Can you see the website, Danielle?
Yes, we can.
Okay, so this is the public side of the website. Right now, this is all fake data. However, all these stations are actual station locations. This has 3 different programs on it. It'll have the coastal. I'll show you. These are the coastal monitoring stations. Then we have the freshwater monitoring stations. This adds 36 or 37 stations. Now, these stations that are on the
Sherry,
public.
I'm sorry to interrupt, but it's still on the slide of the public facing.
Gotcha.
Okay, we can see the website now. Thank you so much.
Okay. So.
Oh, I'm sorry. It unshared.
Oh, no. Is it showing it?
Yes, yes, it is. Thank
Okay.
you.
So the 3 programs, let me go back into this to respond. Oh, I'm over here. Sorry. So the coastal, these are the coastal stations. We have 217. And then these freshwater stations, this is new this year that we're going to be displaying to the public, these freshwater locations. These are the freshwater bathing beaches at lakes that only require a beach badge. If you have a public recreational lake with swimming that requires, say, that you live in a certain development or you attend a campground, Those will not be shown on this public site. However, we did build the back end of the system to be able to handle that data. So it still provides that fast communication between the local health authorities, the owner operator, DEP, and Department of Health. So these are the freshwater locations. If it's green, it means it's open. If it is yellow, there's a swimming advisory, and if it's red, it is closed. And then we also have environmental sites, which is something DEP monitors. It's at locations where people do primary recreate, but it's not a lifeguarded beach. We also have, as I was mentioning a little bit, about our aerial surveillance, which I'll go into a little bit. So we fly over the coast 6 days a week. We have an observer on the plane looking for anything harmful to swimmers, and we also fly over the lakes 1 day a week. This data can also be entered with the latest flight data from our remote sensor. We fly over these lakes up here on Tuesdays during beach season, and it includes Round Valley, Spruce Run, Mohawk Lake, Lake Musconetcong, Bud Lake, Lake Hopatcong, Swartzwood Lake, Boonton Reservoir, and Greenwood Lake. And you can add that the latest data to the website to also see what, with the remote spectral sensor on the bottom of the plane, it's giving data estimating through the light reflecting off of the water surface, and then it uses an algorithm to estimate the chlorophyll A levels over the coast and also the cyanobacteria levels up over the lakes. So that data can also be entered onto our website. We have other information. We'll have reports on each flight. We'll give a written narrative report. We've updated our FAQs and our partners, etc. That's just the front end of the website. Now I got to go back. I'm going to share the back end now. So I'm logging in as if I was part of the New Jersey State Parks. There are 10 public freshwater bathing beaches as part of the parks. And this is the back end. It'll give you this dashboard with information. You can see the 10 beaches. Again, all of this is fake data minus the locations. Right here, you have the opportunity to manage the user. So you can add your owner or operator to enter data and give them only data entering permissions. This is where beaches are added, which we will add the beaches for you. Simply you go to results and you would have your beaches listed for your organization, and you would just submit your data. And then the local health authority has the opportunity then to verify the data. So if you had the owner or operator of the beach entering the data, you would then go to the result verification. Their data would show up, and you would verify that data before it goes to DEP and DOH. Incidents are shown on here. These are the advisories or closures. If it's purple, it's missing some type of information. A lot of times sanitary surveys take a little bit longer to enter into the system, but hopefully this year it'll go quicker because our new website is mobile friendly. So people the health inspector, whoever doing the sanitary survey, can actually do it on their phone or their tablet out in the field. I'm going to go into sanitary surveys in a minute, but entering that data will automatically do the 30-day rolling geomean for you. And that will just show up here. Again, I'm under state parks, so there's 10 beaches here. This is all fake data, but you can see it will update that rolling geomean right here for you and let you know if you exceeded that rolling geomean limit, which for freshwater is 100, E. coli, and marine water is 30 enterococci. Also, the serious and fatal accident report has been added to this website, so you can submit this information. It is the exact same form. Immediately as you hit submit that form, Department of Health is going to get an email notification that a report was submitted, and get that information immediately. The last thing is just to change your password. So this is our new beach system. As I said, this is all fake data right now. It should be cleared out and go public. I'm going to go back to my website. My PowerPoint. Within the next week or two, it'll be live, the website, at njbeaches.org. Now I got to jump to where I was. Okay, so now I am on to sanitary surveys. So I showed you that you can add sanitary surveys from our beach management system. This is going to help you identify the potential pollution sources. We updated this last year based on recommendations from EPA and then our experience with source tracking projects. Pre-season sanitary surveys should be conducted a month or two prior to season. This will inform seasonal changes at the beach and in the watershed. And then sanitary surveys should be conducted after all water quality exceedances by duplicating the pre-season survey to identify changes. Sanitary surveys for recreational waters involve collecting information at the beach or the water body shoreline, as well as the surrounding watershed. It starts with basic information that can be collected at the water body's edge, like water conditions, beach conditions, such as, the tide, if it's ebbing or flowing, wave height, if it's the ocean, if there's an abnormal water color or odor, are there people in the water? Is there a lifeguard on duty? Are there tidal pools or other water ponding present at that location? And then the form assists by going through potential pollution sources. Are there nearby stormwater outfall pipes? What's the land use of the drainage area of the stormwater outfall? Is it park, residential, city sewer, or septic? Maybe there's a nearby failing septic system or sanitary sewer leak or overflow. Is there a dog park nearby or an area where a lot of people are walking their dogs? Maybe they're not picking up after their dogs. Are there farms nearby that aren't managing their manure properly? Could there be a lot of wildlife nearby? What types of facilities are around? Maybe there's leaking dumpsters from a nursing home or a medical facility. And then are there upstream, what are the upstream waterways? Is there a nearby marina with heavy boat traffic that might be illegally discharging waste? So what's the location and condition of nearby bathrooms? Could they be hooked up to the wrong system or leaking? And then also be mindful of activities or events. So a few years ago, we randomly had some exceedances at beaches that never failed to meet the standard. And after further investigation, we found out they had a food festival on that beach that created an influx of people and overflowing trash cans. And then those trash cans attracted significant number of seagulls. This could easily be avoided by, in the future, having extra receptacles and more frequent emptying of those receptacles. If possible, it's best to obtain sanitary sewage and stormwater infrastructure maps, and that could help with water quality problems in the future. So the final information on the sanitary survey form is all about algal blooms. Is algae in the water on the shoreline, and what type of algae? Is it stringy or are there blobs floating? What's the color? Are there dead fish or other wildlife present? Has anyone reported an illness? And if the predominant algal species has been identified. If not, DEP can help with that. We can go out and grab samples and bring it back to analyze it under the microscope and identify and quantify the species to determine if there is a harmful algal bloom. So before I showed you a little bit about our aerial surveillance, again, we fly 6 days a week over the coast. We start mid-May and we'll go all the way through October. And we have the trained observers on the flight looking for anything harmful to swimmers, as well as that remote hyperspectral sensor, which is the early detection tool for harmful algal blooms. Again, if we see high levels, in the red over several days, we will send out a boat captain to go get water samples to bring back to the lab to identify the species and quantify. Our program can also help with source tracking for recreational bathing beaches with chronic water quality problems. And when you see the amount of fecal coliform from a single dog can cause over 5 billion fecal coliform per day, and a Canada goose, 87 million. fecal coliform a day, or one seagull, 142 million fecal coliform per day. So these seemingly insignificant sources can easily be identified in the sanitary surveys and have huge impacts on water quality, especially when multiplying by many dogs, skulls, and geese day in and day out. So at the DEP, we can help gather stakeholders, do additional analysis of the data, conduct intensive monitoring studies, maybe tide studies or storm studies. We will analyze the samples. We have additional advanced analysis that we can perform, such as coliphage, bacteroides, or antibiotic resistance analysis. And those results will help tell the source of the bacteria, whether it's human, domestic animal, or wildlife. So we can help identify the source and facilitate the elimination of the source by pulling in our enforcement group, if needed, and working with our municipal finance group and New Jersey Water Bank to assist with funding, again, as needed. So that's all I have for you guys today. Thank you. If you would like additional information, here's my email and telephone number. And I'll hand it back to you, Danielle.
Thanks so much, Sherry. I appreciate you. Again, if you have questions for Sherry, please put them in the Q&A. And anything that we are unable to answer during this webinar, we will be providing a FAQ. All right, so lastly, we're going to talk about Youth Camp Safety Project. And youth camp registration opened March 17th. We probably have about 400 or so, 500 youth camps registered to operate this season. In anticipation, we generally register about 1,100 youth camps across the state annually. The youth camp safety standards, the current standard, the youth camp safety standards were revised. The document has been approved and should be posted within, a couple of days, maybe a month. I'm not sure. However, nothing that was currently adopted in the revisions goes into effect until 2026. So at this point in time, anything that is enforceable in the youth camp safety standards was anything that was already in the rule predating 2026. So municipal camps are not required to register, but registration is strongly encouraged. Criminal history name-based background checks are required. Fingerprint-based background checks exceed the requirement of the name-based check, so they are accepted. The proposed revision, which again has been adopted, there's two key changes for 2026, which are municipal camps will continue not to be required to register, and fingerprinting will be required for sleepover or resident camps. Once sometime in the fall or early spring, I'll be offering another training to go over the specific changes in the youth camp safety standards that will be enforceable for 2026. Requirement to notify. Any youth camp that has submitted an application to register as a youth camp and chooses or decides after submitting their application and being issued a license that they do not want to operate a youth camp, they must notify the Youth Camp Safety Project at youth.camps@doh.nj.gov. The camps must notify the department before the operational inspection is conducted. The local health department can notify the department, but we prefer that information to come from the camp operator, just so that we are clear that the camp operator who has paid the fees to operate chooses not to operate. Once we receive that notification, their license will be inactivated. They will no longer show up on the operating list that we have on our website. And our folks and you folks will not go to those facilities for a pre-op or operational inspection. Failure to notify does result in, may result in fines and penalties. The pre-operational inspections are conducted by our local health officials, as you guys know. It applies to all youth camps within your jurisdiction, including single sport youth camps. ACA camps may receive a pre-operational inspection, but are not required to receive a pre-operational inspection. So if you receive notification from an ACA camp asking for a pre-op, you can tell them that they are not required to receive a pre-op. We also try to notify these folks that any camp affiliated with the ACA does not have to receive a pre-operational inspection, so they aren't reaching out to you to schedule those inspections. The inspection form is available under our regulator tab on the website. The pre-operational inspection forms must be completed and emailed to youth.camps@doh.nj.gov. These forms should be submitted within 10 days of completing the pre-operational inspection. As far as guidance when completing the pre-op form, we encourage you to prioritize your inspections. New camps, the operation dates, and compliance history all factors that should be taken into consideration when doing your inspections. The form layout. Items that lack a reference code in the code column are not violations. Example, question number 2. If accepting children under 2.5 years of age, the facility is licensed by the NJ Department of Children and Families. This particular question is an assessment question. We're trying to find out if there are organizations operating that take care of children under the age of 2.5. The Youth Camp Safety Standards does allow for this activity. However, the Youth Camp Safety Standards is not the best regulation for this age group. So we're trying to identify these camps and inform them that they should be applying for a Office of Licensing child care license if they're caring for kids that are under the age of 2.5. It is not a violation for them to do so. However, there's a better regulation, better set of standards for that age range of population. Items in red have been identified as frequently cited violations based on our operational inspection reports. Example, question number 21, asking about the health director at a day camp if they're certified in standard level first aid. Complete the form as clearly and as completely as possible, using the checkboxes yes, no, not observed, or not applicable. Complete the inspector and PIC details at the bottom of the form. And here's a picture of the bottom of the form. Local health departments are expected to follow up with the corrections prior to the camp operating for the season. However, once the camp starts to operate, the pre-operational inspection of the camp is no longer required. So I encourage you to try to get to these facilities prior to their operating for the season. If you can't, then there's no pre-op required. New this year, our operational inspection reports are available online. The inspection reports are available here at the link. I'll make sure that you guys get it in the chat. The complete inspection history is starting. Any complete inspection history from 2024 is available online. Any documentation prior to 2024 would not be available online. because we had not started using the inspection reporting system that we currently use until last year. So, which makes us have the ability to make these this information available to you. The Child Care Subsidy Program. Child Care Subsidy Program is a program offered by the Department of Human Services Division of Family Development. In your towns and regions, you may have awareness of the CCR&Rs, or the Child Care Resource Centers, that help families, low income and moderate income families, apply to the Department of Human Services for the subsidy program. Last year, we had approximately 135 registered camps statewide participating in the program. If you have awareness of any camps that are any parents or families that need additional supports to provide childcare for their families, please have them reach out to childcareinj.gov so that they can apply for the Child Care Subsidy Program. The department is hiring. We're looking for 2 formerly licensed or currently licensed REHSs for a period of hire June through September. Their responsibilities will be to conduct youth camp safety inspections in congruence with NJAC 8:25. If you have any awareness of any folks looking for a job that meet the requirements, please have them email me at danielle.clemens@doh.nj.gov. So what did you learn? If you'd like to participate in this brief 10-question survey, please scan the QR code. I'm actually hoping that we have a lot of participation because we did share a lot of information here. So let me stop sharing that. And share the form. Okay, Janelle, can we see the form?
Yes, we see the form.
Perfect. All right. So, under what circumstances can completed forms submitted to the local health department be accepted in lieu of an on-site pre-operational inspection? There's the link. Hopefully we have folks completing it. We got 0 responses. Come on, folks. Let's see. Copy the link, put it in the chat. Okay, I put the link in the chat. Hopefully that helps us with getting some responses. Only 1 response. Come on, folks. The link is in the chat if you need to access the link. Janelle, what are we seeing? Always okay, we're getting more responses. You know, there's 200 people on this 200 people on this call.
Oh, Danielle, there's a question in chat about the survey.
Okay, let's see. Not allowed. You have to answer the whole. You have to answer the whole survey. Okay. As you can tell, this is new, so we're gonna have some glitches, but we're gonna do our best and continue to power through. Can you guys see the survey or no? Am I sharing my screen?
You're sharing the responses overview.
Gotcha. Okay. Okay, for this answer, the answer to this question, under what circumstances can completed forms submitted to local health departments be accepted in lieu of an on-site pre-operational inspection for existing PRB facilities? Still getting some answers coming in. Thank you guys. I appreciate you. Looking good, looking good. Now I feel like you guys are all just following that one person that said C. Is that the correct answer? Okay. So as we can see, 79% of respondents answered the question correctly. C is the correct answer, only for existing PRB facilities. Okay, next question. A pool director is required for pools smaller than 2,000 square feet and must complete certified training. Oops. Out of there. The pool director is required for pools smaller than 2,000 square feet and must complete certified training. Looks like 77% of you guys answered this question correctly. The correct answer is false. Third, which of the following statements is true about facilities that qualify for specially exempt status? As an aside, special exempt facilities I feel like that is one of the most asked questions from our local health officials. Knowledge about specially exempt facilities, how they operate, and what supports are required to be in place at specially exempt facilities. It's absolutely one of the most asked questions. So the answer to that question, which of the following statements is true about facilities that qualify for specially exempt status, is C. Specially exempt facilities are only exempt from lifeguard and first aid personnel requirements. They absolutely must implement every other aspect of the rule. Question number 4. Which of the following is true regarding the difference between chemical controller systems and water quality monitoring devices? A chemical controller system automatically adjusts chemical levels, while water quality monitoring devices only provide real-time readings and do not adjust chemicals. That is true. A, chemical controller systems adjust chemical levels. Water quality monitoring devices only monitor and do not adjust chemicals. 5, an emergency shutoff switch must be installed at public recreational bathing facilities per UCC regulations. That is true. That requirement is under the UCC. 6, an automatic external defibrillator is required to be available on site if the pool has a lifeguard on duty. That is true. Only in the case of a lifeguard being on duty is the AED required to be installed on site. Number 7, which of the following incidents must be reported on the Fatal Serious Accident Report Form, or CB2 form? That will be any injury causing unconsciousness, an injury to the head, neck, or spinal cord. So serious injuries would be required to be reported using the CB2 form. An aside about the CB2 form, or the Fatal Serious Accident Report Form. We got a question in the chat or the Q&A asking about the autopsy or toxicology reports. Because that information has PII, or personally identifiable information, those reports or those additional data is not required to be submitted with your Fatal Serious Accident Report Form. The Fatal Serious Accident Report Form is unidentifiable personal information. It simply asks the number of victims, the conditions at the PRB when the drowning occurred or serious accident occurred. So you would not want to submit to us the autopsy or any personally identifiable information when you're submitting your Fatal Serious Accident Report forms. Great question in the chat. Thank you for asking it. 8, when must the Fatal Serious Accident Report Form, or CB2, be submitted to the Department of Health after the facility notifies the local health authority? So when must the Fatal Serious Accident Report Form be submitted to the DOH after the facility notifies us? Within 5 days. So B, within 5 days. You do have to submit the form within 5 days. You have to notify us within 24 hours that the facility notified you that there was a drowning or fatal serious accident. For bathing beaches that are not part of the CCMP program, How often must the local health authority transmit the 30-day rolling geomean to the Department of Environmental Protection? I'm sorry, to the Department and the Department of Health and the Department of Environmental Protection. And yes, you are correct when you selected monthly. So if you are not part of the CCNP program and you have to submit the 30-day rolling geomean for your lake, river, or non-tidal PRB, you will be submitting that 30-day rolling geomean data monthly. And lastly, what must be done within 24 hours of an unsatisfactory microbiological sample result for bathing beaches that are not part of the CCNP program? That will be D. The sanitary survey must be conducted and signs must be posted at all beach entrances. I appreciate you guys for completing the survey. Hopefully you found that this pretty informative quiz helpful in understanding your PRB responsibilities. Let's stop sharing this. Lastly, let me post the evaluation form for you. I'm going to give you the link. So you guys can complete that. That is it. Okay, let me share this PowerPoint so you guys can also scan the QR code, because if you want to earn CEUs for attendance, you must complete the evaluation. So scan this QR code, or the link for the QR code is in the chat. You'll only be awarded CEUs for live attendance, and you must submit the course, complete course evaluation in order to receive your CEUs. Lastly, if you are a local health official and you are participating with a group of you guys are gathered together watching this, participating in this webinar, you will need to have your health official or your health officer to forward to me. I'm sorry, to youth.camps@doh.nj.gov, have your local, your health officer contact us with the names and associated emails of your NJLMN accounts of the individuals that are in attendance so that we can ensure that you receive the appropriate credit for participation.
Danielle, the link in chat is not the evaluation, that's the quiz again.
Okay, let me see if I can. I apologize for that. Okay, just a second. I'm adding it to the chat now. So you have the eval link. The health officer email. Yes. So if you're a local health official and you guys are participating as a group, have your health officer contact us at youth.camps@doh.nj.gov with the names and associated emails of the participants' NJLMN accounts. So I need the emails that I need your health officer to let me know the email that you use for your NJLMN credits of those who attended so that you can get the credits. I'm scanning through the chat. I don't see any other questions. I will leave it open for questions or comments. Please repeat the email. Is youth.camps. Okay. No, if you're a health officer or a health official and you've watched a loan, you don't need to do anything. This is just for folks that are participating as a group. If you participate as a group, there's no way to ensure, or there's no list of your attendance in the attendance log. So you may not receive the credit. So if you're watching as a group, make sure that you have your health officer send the email so that your credits can be issued. Yes, the graphic for the fatal serious accidents at guarded pools is available on our website. We have information about the statistics associated with our fatal serious accident report form, and that information is available on our website. Absolutely. Okay, well, again, I appreciate you all for participating today. Thank you to all the presenters who provided valuable information for our summer activities. I appreciate your help. Please let us know if you have any questions or concerns, and have a great day.